Hi friends, I am Dr. Rahul Khanna, consultant knee and shoulder surgeon, Paras Health, Udaipur. Today is World Arthritis Day and I would like to make you aware of this day because this day is dedicated to all those patients who are suffering from one or the other form of arthritis across joints. So my advice to you is on this World Arthritis Day is to seek for medical help as soon as possible so that you can continue with your treatment and get back to your normal life forever. I am here to talk about sports medicine as well as its impact in today's world where athletes or students or young generation are thriving to pursue their career in the field of sports. So what is sports injury? Sports or sports related injuries are injuries that are usually suffered when an athlete encounter any miss happening over the field or off the field while practicing. So sports related injuries in a nutshell is the injuries that are acquired during the process of sport or athletic event, and these are treatable kind of things. The sports injuries these days are treated with the help of what is known as arthroscopy or keyhole surgeries. The three major joints where sport injuries are commonly seen are hip, shoulder, ankle and knee. Among that, the knee and shoulder injuries are the most common, where it can have a moribund effect or a dramatic effect in the athletic profile of an athlete. So the crux is whenever an athlete faces any kind of injury while playing or off the field, he should definitely and as early as possible consult a sports medicine physician, a sports medicine psychologist or a sports medicine physiotherapist, where he has to get diagnosed his injury so that it can be treated as early as possible. The diagnostic modalities are commonly available in the city of Udaipur these days, as well as the treatment modalities. The diagnosis can be done with the help of clinical examination as well as radiologically with the help of MRIs, which are readily available now. After diagnosing, the first part is to assess the stability profile of the patient or an athlete as well as the muscular imbalances that is occurring across the joint. So once we have settled with that, the patient or the athletes undergoes first the surgical aspect, in which the ruptured ligament or the ruptured soft tissue structure is repaired first with the help of arthroscope or with the help of keyhole surgeries. After that, the patient is kept on rehabilitation program, where we go for three kind of rehabilitation. The first one is to regain the range of motion, that the complete range should be ascertained. Secondly, the strengthening of the muscle should be done, and once the muscles are strengthened enough, the patient or the athlete goes back for endurance training or sports specific physiotherapy, in which he has to start looking about his injury in such a way that he can again start playing his particular game. So the best part to get treated is to look for an early diagnosis as well as early treatment, because the crux of orthopedics today is that as early you are diagnosed with your problem, as early you are treated, you are back to your normal routine. So I would like to concentrate as well as explain you that whenever you feel injury across your joints on and off the field, you should immediately go for the surgical advice or the surgical help so that your problems can be sorted out earlier. Secondly, the injuries can be prevented, so that will be the best part, because prevention is always better than cure. So the best part to prevent an injury is to have a proper hydration, to have a proper nutrition, as well as to have a proper regular exercise schedule, so that your muscles as well as your ligaments across the joints are strengthened enough, they are well toned, so that it can be avoided during the case of injuries. Keyhole surgery is basically a small hole or a daycare like procedure in which the joints, whenever you got it injured, say for an athlete or for anybody who has got an injury across the joint, and we commonly come across the ligament injuries or the soft tissue injuries across the knee or shoulder. So there As you have heard about laparoscopy, in which a small camera-like structure is put inside that particular organ to visualize the things. Similarly, an arthroscope is a small camera that is put inside the joint. Once that joint is visualized big enough, so that is connected to a TV screen or a monitor where we can visualize the joint in a better aspect, in a better way. And once that diagnosis of that problem has been completed, we can go for a therapeutic intervention in which whatever repair work is required, we can go for simultaneously repair as well as treatment of that particular issues. The advantages of keyhole surgeries or arthroscopy are: first, it can be done as a daycare procedure. You don't require long admissions in the hospital. Secondly, it is bloodless surgery. There won't be any bleeding. The recovery time is relatively fast. There is no joint opening, so there won't be big scars, as well as you can get back to your routine as early as possible because you have avoided all the major drawbacks of a open surgery. So I will like to thank WorkMob for inviting me to share my thoughts here.